There is no vaccine for valley fever.
Valley fever is technically an orphan disease. The FDA definition of an orphan disease is 200,000 illnesses at any one time. And we are under that number. Turns out that almost all of the disease, that is, 2/3 of the disease, occurs in Pima, Pinal, and Maricopa counties here in Arizona. Simply put, if it's an orphan disease, there aren't many people that need the therapy if you look at pharmaceutical business models. And so it's been very hard to develop or get a pharmaceutical company interested enough to go to what it takes to get any drug through the FDA process and to market.
The disease itself, I think there's almost a lot more questions than there are answers about it. And, it's kind of sad that it's, as they call it, an orphan disease. They don't have still don't have the drugs that, can really fight it well.
None of the drug companies, none of them are interested in this disease. Because first of all, it's not a worldwide disease and they can't make any money.
I think for the vaccine and for the Nicomycin Z project, we're going to need partners to increase the funding, because it really does take a number of millions of dollars to bring things to clinical use.
Dr. Susan Hoover, Section of Infectious Diseases, University of Arizona College of Medicine.
Well, we have funding from the federal government and from some charitable donors for our first phase, which is just to administer it to 60 people for a short course. But then there are hurdles regarding the manufacturing of more drug and the expansion to larger trials. It's going to take probably a partner with us and the university to develop this drug further.
The Department of Health Services is conducting a public education campaign urging people to seek care sooner for their valley fever symptoms. We are encouraging patients to ask for a valley fever test if they have a prolonged cough, fever, and fatigue.
If you're getting sick, go to the doctor. And when you go to that doctor, mention to him, could this be valley fever?
We are also educating providers to test for valley fever, especially among patients with pneumonia.
If more people knew about valley fever, knew the symptoms, knew how it affects your body, then maybe the physicians would think about it more.
If we only have a very small, a handful of physicians who are specialists about valley fever, and all of these other doctors are telling us completely the opposite of what the specialists are saying, there's something really wrong here, because a lot of people aren't going to get to those specialists.
We have a new website so that people can learn more about valley fever. In addition to physician education, public outreach, and enhanced surveillance of people with the disease, we are working to map all reported cases of valley fever and to look for geographic patterns and/or any correlation with dust. We are also working with the University of Arizona, the Valley Fever Center for Excellence in Tucson, and TGen, the Translational Genomics Research Institute, on education campaigns, drug and vaccine development, and investigations into climate changes.
2/3 of the disease in the country is in Arizona. The Department of Health Services has shown there's a substantial cost in terms of lost work and time spent receiving care for this disease, and so this is the place where we need a new drug for this disease if we need it anyway.
Talked to Dr. Galgiani at length about Nicomycin Z and all their work there, but it probably won't have any effect on me, but hopefully people in the future.
There's I know just a few people that are affected this way in comparison to people just getting valley fever and then not really knowing about it and not really knowing that they have it and then just going on with their lives. There needs to be something that we need the research, period. We need the funding for more research on this, and so that other people don't have to go through this.
If they put valley fever out in the forefront, people would think about it more. Maybe the doctors would think about it more. So I think they need to fund it fund the research so that people know what it is.
I know a little bit about the test program that you're going into, but it's for people, as I understand, it's just diagnosed and you have a younger age group. So the old guy here's left out on that one.
I'm not going to live long enough for a vaccine or something to come out. I know that. But I don't want to see somebody else go through what I've been going through.
The new stuff they're trying to come out with now, it's all headed in the right direction. And if they can ever get this stuff on the market where a person, all they have to do is get a shot or a pill, it's going to be the greatest thing in the world.
David Engelthaler, Director of Programs, TGen North.
This is clearly an area where we're just scratching the surface. We're just now applying the tools that have really been available for the last couple of years. And our technology is advancing, and as it does, we want to really apply it to this disease so that we can really get our arms around what's going on in Arizona, hopefully develop better treatments, maybe new vaccines, and potentially learn more about the ecology of this disease and how actually it occurs in nature and goes on to infect humans. And so but the only way that's going to happen is if Arizona keeps addressing this issue. I mean, the federal government realizes or knows that it's out there, but it's a Southwest disease. It occurs in Arizona, California. Arizona really needs to take this on as its disease, as its pet cause, and provide more funding and guaranteed funding into the future for us to really tackle this issue.
Now that you know a little bit more about valley fever and the symptoms of valley fever, you're better prepared to talk to your physician about valley fever should you get symptoms similar to the ones that you had just seen. As you can tell, Arizona is faced with living with valley fever, and it can be scary, but it's also something that you have some control over because now you know how to recognize those signs and symptoms. And we're partners with you and everybody here in the community. We're working with our partners at TGen, other research institutions to try to figure out a little bit more about valley fever so that we can give you some additional information about how to protect yourselves.
Valley fever is Arizona's disease. For more information about valley fever, please contact the Arizona Department of Health Services, 602-364-3676, or visit our website at www.valleyfeverarizona.org. For updates on research and development, contact the Valley Fever Center for Excellence, 520-629-4777, or visit their website at www.vfce.arizona.edu. This program was produced by the Arizona Department of Health Services.